To this now, as we begin 2024, mental health remains a challenge. In April 2023, South Africa held its first mental health conference to give a platform for dialogue and the policy framework and strategy to guide efforts to implement and address mental health. At the conference, the Minister of Health, Dr Joe Phaahla, raised a concern that at least less than 30% of people who suffer from mental health illness receive treatment in South Africa and the rest do not. Some remain undiagnosed. On this, we are now joined by clinical and sports psychologist Dr Keitumetse Mashego. Dr Mashego, thank you so much for your time this afternoon. So how prevalent would you say that mental health is in South Africa, considering, of course, what we've just said now in terms of the first conference only being held last year?
Good afternoon and good afternoon to your listeners. Mental health issues are very prevalent in South Africa, and it's very it's sad that it's only now, starting to get the attention it should have been getting a long time ago. But of course, we also celebrate the fact that it is getting the attention that it needs and deserves. Mental health issues are really something that is very important, that should be prioritized the same way our physical health is prioritized. But because of the stigma, there has been a delay in advancing that promotion of mental health and mental health challenges in South Africa and the world at large.
So in our introduction, we said, of course, that at this conference, at the mental health conference, Dr. Joe Phaahla raising a concern that less than 30% of people who suffer from mental health, illness receive treatment. And of course, more concerning is that some of them are not diagnosed. I mean, how can we remedy this situation?
I think we need to have more access to tertiary institutions. That is where psychiatric help is achieved at tertiary institutions, and we need to have more access to that, and also more professionals in this regard, because there is a limited professionals to serve a very large community, and which is a very sad case in South Africa. So we really need to do the work to ensure that there is a lot of professionals and accessibility available to the population out there, but also to get people to seek the help before there's a crisis. I think what also overwhelms the system is that there is usually a lack of starting before there's a crisis. So people come to the hospital when there's already a crisis, and people should know that there is public health services where they can access such services, because people believe that it's only available in private sector, but there is also a public sector where mental health issues are serviced.
When we start talking about mental health disorders, we know, of course, that this speaks to a number of mental health conditions. Perhaps just unpack some of the most prevalent that you are seeing, and perhaps more serious cases.
Mental health issues run on a continuum. So you get your day-to-day adjustment where someone is just coming for a check-in, or they're struggling with, just day-to-day stresses. And on the other end of the spectrum, that's where you get the severe pathology, where you get your personality disorders, or people coming in with clinical depression. We get a lot of anxiety as well, especially post-COVID, where you get, people are highly more anxious than they were before. And there was also a lot of grief and trauma, that happened, in the world, but specifically in South Africa as well. We lost a lot of lives in that period. So people are really having this, grief and trauma processes that are playing out even now, post-COVID. So there is a lot of that happening as well. But most of the cases usually is the major depression disorder with anxiety, and also you do have your psychotic processes, meaning your schizophrenia as well, that are also prevalent. And you do get, unfortunately, some of the personality disorders where they play out also as antisocial personality disorders or narcissism. That's where you also see your prevalence of the rise in crime as well, with people who are not having a lot of remorse. And you also, because of the GBV that's going around, there are people who need to deal with their own, traumas from past relationship and childhood traumas. So there is also GBV in that, from the side of the victim, but also the abusers, that needs a lot of attention in South Africa.
How would you then advise somebody who knows that, there possibly could be something wrong because they are displaying, just some of the things that you've just mentioned now, including anxiety, maybe some depression caused by something else, it's then manifesting into that condition. Where would they then begin in terms of seeking help, but also using other alternative methods outside of just medicines and that they would be prescribed, by doctors? What else would they have to then consider?
With psychological or psychiatric or mental health issues, one must want the help. So there is that need to be self-aware or to be aware when you are not coping or not doing well or managing stress very well. So, and the important start-off point is to realize that it doesn't mean you're weak, it doesn't make you less of a person when you struggle with that, as some people are more predisposed to mental health challenges the same way some people are predisposed to cancer or your diabetes. It's literally the same thing in that I think that's the message we also need to promote out there, that some people are more predisposed to mental health challenges, and hence you will get two people go through the same thing, and one might be likely to experience depression than the other. Is because they're more predisposed, and of course exacerbated by the environment and the stresses. So we need to just promote that. But people who are struggling, firstly, they can go to, if they don't have medical aids, they can go to the nearest public health clinic and inquire about the clinical psychologist in whatever nearest to them. And if the clinical psychologist picks up that there's a need for referral, the clinical psychologist will do so. And when it comes to alternatives, when someone is already diagnosed or struggling already with clinical presentation, so meaning that it's not just symptoms of depression, but they have clinical depression, unfortunately at that stage, there is a likelihood that there might be a need for medication or referral to, other specialists such as the psychiatrist. But in cases where someone is still, for example, in the starting phase or the beginning phase of depression, or it's low-grade depression, of course, then we can, do other things such as, alternative interventions, such as, for example, more exercise, looking at their diet, and just looking at their physical health, because sometimes somatization happens and it's exacerbated by, mental health challenges. So, for example, someone who's anxious might present with irritable bowel syndrome or something wrong with their stomach, and something that cannot be healed. And when you look at it, they've got some traumas or stresses that they need to navigate and process. So I think the important thing is just to be self-aware and to take a health check-in holistically and really sit with self, which is not always easy for human beings.
And I think that's very important, particularly at this time of the year. But thank you so much, Dr. Mashego, for your time this afternoon. That's clinical and sports psychologist, Dr. Keitumetse Mashego.